Welcome to Between Two Psychs, a podcast where two psychologists and board-approved supervisors deep dive into many of the questions and challenges that provisional psychologists and early career therapists face in everyday practice, during training, throughout the internship, and beyond as they progress into working more independently. Your hosts, Isabelle Tombleson and Claire Trevitt, talk about a range of topics, specifically relating to psychologists and therapists who are just starting out.
Hi, Claire.
Hi, Isabelle. We're back again.
We are back again, and we are going to be talking about a topic that you came up with. This is something that you're quite interested in sharing. It's a practical episode for all of our provisional psychologists who might be in a 4+2, 5+1, or even in some sort of other master's level program of study who are on placements or working in the workforce and need to record observations.
Yes, it's actually a requirement of the internship, both the 4+2, which I know is being retired, and also the 5+1 internship. But I think that it would also be a requirement in master's programs.
Yes.
And also anybody who's early career who is, or even later in career, who is completing any type of accreditation, whether it's for schema or EMDR, I had to record just one session. But there are many trainings that do require these observations. So we just thought it was actually something that is something that impacts all of us.
Yes, that's so true. That's so true. So what would you say is the most important thing to set up when you're starting on placement, or you've found yourself a paid job and you're going to be going through one of the programs of study to become a psychologist or one of the other types of therapists? What would you say the first thing is that you would need to do?
If you are completing an internship more independently, as in you've got one of the internship pathways, these roles are not necessarily set up specifically for internships. And if that is the case, it's really important to find out whether or not you can record sessions or how it's going to work. So is your supervisor going to sit in the room with you? Is your supervisor going to live stream in while you sit with a client, or are you going to be allowed to record sessions? If you're not allowed to record sessions in a placement and no one is on site to observe, you're not going to be able to meet these requirements. So I think the first thing is this placement actually going to be a placement that is going to allow me to meet this requirement? Because it is essential. You're required for the internships to complete 2 interventions and 2 assessments every 6 months that are observed by your supervisor. And so it's really important to know that this can actually happen, accept a job.
Because this can happen, can't it, Claire, where a student will find a placement or they'll find a workplace where they can undertake their program of study. Yes, they might be aware that they need to somehow record observations or have someone sit in, and then all of a sudden someone in the organisation or somewhere in management, they say, oh, no, sorry, you're not allowed to record. You know, there's might be some restrictions on what they're allowing you to do, not understanding that this is, without this, you can't undertake training, essentially.
Exactly. Yeah, exactly. Or some provisions need to be made internally to allow that to happen. And ideally that would be communicated early on with your supervisor. So if your supervisor's internal, that's probably less of an issue, because if they're internal and on site, they are probably likely to be able to sit in on sessions. It's when you have an external supervisor and the organisation has specific requirements about not having external people observe clients, which for confidentiality does make sense. But at the same time, your supervisor is aware of all of these ethical requirements, and there will be things put in place to ensure that this information is secure and is also going to usually be, the recordings are usually destroyed afterwards.
Mm, mm,
So I
mm,
think that's the first thing to be
mm,
aware of, because if AHPRA find that you're getting behind on these observations, I mean, even during COVID, I had some people who were falling behind, and AHPRA were like, well, it's just a requirement, so it just has to happen. So yeah, there's not much leeway, and I've seen progress reports being kept in assessment, as in not immediately approved,
mm,
because they're behind on the
mm,
observations.
mm. And this would apply as well if you're going through university and you're in, say, like a clinical master's program, and you're having to find your own placements and find your own supervision. The university is responsible for checking off that you're meeting the observation requirements, and there is a set number of observations that you're required to undertake per placement. And yeah, the university will be watching that closely. I'm not sure what the consequences are when the university is responsible, but I'm sure that they may not approve a placement if you haven't completed the required amount of observations. And on that note, I just want to share, as a supervisor, I encourage supervisees not to just aim for the minimum number of observations. The minimum, it's a minimum. You can record and observe more than the minimum, and the more supervision, the more sessions that your supervisor observes, the better, the more feedback you're going to get, and the better you're going to get a lot quicker.
Yeah, very, very true, because it can be so valuable. The other thing, actually, just to highlight as well, that's so important, is that these are observations with real clients. So there is no simulation here. Can't be a role play with another provisional psychologist or a role play with a supervisor. It needs to be an actual session with an actual client. And this needs to occur at least 4 times every 6 months. And this is whether you're full-time or part-time. So part-time internships actually do require many more observations. And as you say, there is a real benefit to that and getting that feedback.
Absolutely. There's a reason why it's a mandatory part of all of the training avenues for psychology. And I'm certain for other counsellors and therapists as well. So, okay, so everything's set up at the placement. We've got the okay. What would be the next important thing to be thinking about?
Well, I would encourage people to be thinking very early, because, of course, that first 6 months can fly by, and getting 4 sessions set up and arranged to be recorded, and making sure that you have got time in supervision to observe those sessions, is getting a really good process set up right from the start. And this, I think, should really be across the organisation, depending on who is making the referrals and who is taking in the intake information. So
admin staff as well.
Absolutely. So I've actually created a mini guide, which includes some scripts for both admin staff and for provisional psychologists, and that's available it's free, and it's available on my website on the resources page, the growingtherapist.com.au. So you're welcome to download that. I include a little bit of a guide to what's required, but also 2 scripts, which I think and I think this is what's really important, is that clients need to be aware that they're seeing a provisional psychologist. And part of seeing a provisional psychologist is seeing somebody who is under supervision. And in order to meet the requirements of the internship or the training, these observations are mandatory. And if clients are aware of that right from the start, that they will be asked right from the start whether or not they're comfortable. Now, they don't have to say yes, but I think they're more likely to say yes if they're aware that this is part of the requirement and also what it means. So someone else is going to be watching this session. So you've essentially got 2 psychologists present. And so not only are you going to get feedback on your performance as a provisional psychologist, but also there can be some real discussion around this particular client's needs. So this client is having two professionals tending to them in a way that's actually very unlikely to happen in any other situation.
That's such a really good point. And if you were a provisional psychologist, or if you were working in a practice, that would be a great way to sell it.
Absolutely, absolutely. And I think people say, I hear people on the recording saying, thank you so much for allowing me to record this. And I do think that, you know, an appreciation and a thank you is appropriate, but I also want to get away from that. Your clients are doing you a big favor by allowing you to do this. Your clients are actually allowing you to meet the internship requirements, which then allows you to provide them the service that you're providing them. It's mandatory. It's not an option. And I think if clients know that, and they know that you can't practice without this, they're much
from the beginning.
Yes. Set
it up from the beginning.
Absolutely. And so when admin staff are making the appointments, I think it's a great idea to say, you have been, you know, referred to somebody who is a provisional psychologist, and this is what this means. And do you consent to having some of your sessions recorded, because this is a requirement of being a provisional psychologist. And I think if that conversation is had right up front, then the clients understand, I think you're more likely to get a better response than if you see them for 4 sessions and then say, oh, by the way, you know, I've got this requirement.
That's when it's awkward, isn't it? Yeah. And setting up expectations is so important. I mean, for so many different things, isn't it? But this is just one area where it can really help. I reckon it also helps when it's been noted to the client at the beginning and they've said, yes, that's okay. When you're then the psychologist who's asking to record the session, you don't feel as awkward. It's not as uncomfortable. It's, you know, you can go in with it with more of a confident attitude. And I think it's really important when we sound confident, our clients feel confident. If we're sounding awkward, if we're sounding unsure, if we're sounding nervous, they'll pick up on that, and then they may be less comfortable with doing it. So I think those things come into play.
Yes, because they'll be thinking, well, you know, the psychologist is nervous about recording, and I've got to be recorded too. And it, like you say, it sets up this sort of expectation that it's, you know, it's hard. But I would ideally want it noted down on the intake form.
Yeah.
And so the conversation's had. And the other thing is, if you do get a client who is willing to be recorded, you can record their initial assessment session, because the assessment doesn't have to be always a psychometric assessment battery. It could be a technical interview with some screeners, and then you could record a number of sessions with this. So essentially you could have one client and you could do one assessment session, and you could do 3 or 4 intervention sessions, and your supervisor could see the whole process.
Wouldn't that be lovely, actually?
Yeah, which could be really valuable, because so if you don't need that many clients to consent. So there is leeway for clients to say, no, I'm not comfortable with that. And of course, we're going to respect that. So when clients say, no, I don't feel comfortable, we need to respect that. But many clients will be happy to support the requirement. They'll be happy to have somebody else's perspective. And I think we don't need to apologize for that.
Yeah. Now, you had some really practical tips as well for the actual recording of sessions and the storage of sessions and that sort of thing. What did you want to say about that?
So in terms of recording the sessions, making sure that you've got, I mean, you can do it on your phone, but just making sure that you've got a device that's set up and handy. Ideally, you do want to see yourself and the client, because then you can see the body language. I mean, AHPRA have relaxed a little bit since COVID, but they used to insist only on video, and you'd literally need written confirmation to just do audio, whereas they've become a little bit more willing to accept just audio because of telehealth. thankfully, because that would have actually prevented a number of people from meeting, these criteria. But if you do have access to video, then that's
that would be the first thing you would be doing.
Absolutely. And getting a really good tripod or a holder, they don't need to be expensive. I mean, you could just get something. I think I saw one in Kmart yesterday for about $25 with like a tripod for the phone, so that, you've got it set up well, rather than sort of balancing on some books. And I mean, that may be the case and you've got somewhere great in the room. But just making sure that you set that up and try that out before you've got the client in the room, so it's a seamless process. And making sure that it's shared securely with your supervisor. So my preference is for my provisionals to actually share their screen with me on Zoom, if possible.
Yeah, same.
So that then we're not transporting the document and then destroying it immediately afterwards. Sometimes your supervisor may complete it as an indirect observation, in which case you need to share it as a secure file and then make sure that it's deleted at both ends once finished.
Yeah.
And I put in the consent form. I've also included a consent form in the packages, the mini training that I've described to you. There is a consent form there, and I do specify that the recording is then destroyed.
Yep.
Afterwards. Right. So that's from a logistical perspective. And then I think we've also got that practical element of how we prepare ourselves for these observations.
Yes. Yes. How do you get the most out of them?
Yeah, absolutely. Because it's really, well, also, I think I want to speak to this, and I'm sure, Isabelle, you will too, is it's really nerve-wracking to record yourself. And your supervisor's going to know that. And they're not listening to the amount of ums and ahs, and they're not going to dissect every word that you say. It's a general gist of the session. And so, but we've all been through it. We've all done it. No one likes it, but it's so valuable.
Yeah, we will grow so quickly, and so our skills and our competence will develop thoroughly through this observation process. That's why it's mandatory. But that nervousness, so what I'm hearing you say is we balance the nervousness that we feel in regards to being observed and being critiqued with the knowledge that this is good for us. And if we care about being ethical, skilled, competent clinicians, then those beliefs, those thoughts will be able to negotiate with our nervous responses.
Absolutely, because when you get feedback, I mean, I find some of the best training that I do are trainings that involve lots of role play, but particularly a role play where someone is observing and I can get the feedback, because the reality is that we don't always get things perfect the first time round. We don't always get things perfect, the 50th time around. I'm sure if I recorded one of my sessions, I'm sure I'd find lots of things I could do differently or improve. But it's about trying to do the best that we can, but taking what we do well and running with that, but also being able to correct things early on. And like, I remember seeing myself on camera and I was talking very quietly. As the client was quiet, I found my tone getting very, very quiet, and my supervisor said, "I can barely hear you." And I thought, gosh, maybe the client can't hear me either. And I had to really work on raising my voice, but keep my tone at a very kind of soft sort of tone to my voice, without completely losing any volume.
Yeah. Those just I think those maybe unconscious things, like you're talking about, unconsciously we do things, even if it's like non-verbal stuff, like a movement of the foot. You know how sometimes if we're a bit nervous we might shake our foot a little bit, or maybe we've got some verbal cues that we use that we don't realize, like you mentioned, ums and ahs. you know, sometimes excessive umming and ahhing. Like we try not to critique those parts, but there can sometimes be some of those verbal things that we get into habits of using that, you know, our supervisor can help us just be aware of. And through awareness, we can then, you know, look at adapting and changing. Yeah.
I mean, ultimately, your supervisor wants to help you be the best clinician that you can be.
Mm.
And so I think if you can keep that in mind, and I would like to hope that your supervisor will be kind and encouraging.
Mm.
And if you're finding that that is not the case and that you're feeling, you know, you're feeling highly critiqued, then I would encourage you to discuss that with someone else, or maybe a secondary supervisor, or getting, if you can, a sense from other provisional psychologists, because you want to make sure that your supervisor is matched to you as well. I mean, sometimes I've done some trainings before and I've done a role play and everyone said, oh, that was great. And I've thought, that's good to hear, but actually I want to know what I can do better. So sometimes we don't want too much sort of,
Yeah.
you know, soft sort of touchy-feely, you know, encouragement. We also want that balance. So asking your supervisor for what you need out of the session, I think, can be helpful. I mean, I actually routinely say to people now, what do you need from this? So what do you want me to look for? What do you want feedback on? And so they might say, look, there was a part here and I wasn't sure about. And then sometimes I'll say, you know, that part I think was difficult for you and it was a challenging scenario, but actually I feel you handled it really well. Or it might be, I can see where you're coming from there. That was a bit tricky. And these are some other avenues that you could look at, or different ways that you could maybe approach it. And so if I know what people are feeling uncertain about, then, because it's not always, we can critique ourselves very heavily and we don't always see what we do well. So I would encourage you to ask your supervisor what you want support with, what you want, different sections of the session that maybe you would like feedback on, like maybe something something you felt you did do well, or something that you felt was difficult or didn't go so well, and get their feedback on that. That's going to help you learn, and it's going to be very, very tailored towards your specific needs and development.
And ultimately that, like, you are the expert in what, and you will know yourself best, and the supervisor will be able to see through their lens what they'd like to provide you with feedback with. But yeah, wouldn't it be nice to be able to walk away from a supervision session where a supervisor has observed you and you've walked away and gone, oh yes, like I've grown now. I've gotten what I needed out of that. That was a good experience. What a great learning opportunity. Yeah. So the message, like, through all of these suggestions and tips that we're giving to our listeners today, is to get ahead, get in front, and take charge, be assertive with this whole process. By being assertive with this whole process and organized with this process, a professional with this process, you're going to get a lot more out of it. It's going to be so much smoother and less anxiety provoking.
Yes, it's very hard to catch up on these missed sessions. So when if you don't have a 6-month period and you don't have any observations, you've got 8 to meet in the next 6-month period as a minimum. And then the pressure starts to build, because that then eats up into your supervision sessions, because you do need to spend time in supervision. Your supervisor needs to observe the sessions and provide you with feedback. And it is so important, but you start getting behind, and this is why AHPRA, I think, are really clamping down on this in a way that I've seen more recently than I did in the past, whereby if you're a couple behind, they'll usually approve the plan. But if you get too far behind, the progress reports will remain in assessment until you're caught up. And the other thing is, if you are finding that you're falling behind, there is normally that 28-day period whereby the reporting period comes to an end, and you've got 28 days in which to submit your progress report. Start working on catching up in that time. And if you are sending it within that 28 days and you've completed another couple of observations, write a letter and let AHPRA know that you've already started working on this, because if you're proactive with them and let them know you are aware of this and that you're working on it and you have a plan, they are much, much more likely to then begin to approve those plans. I mean, they get approved anyway. If it remains in assessment, for a year, it will still get approved, but it's a bit nerve-wracking for people when a progress report doesn't get approved and you've got the exam looming and you're trying to get other bits and pieces done. It's sort of something that ideally you want to keep on top of as much as possible, alongside the logbooks and the reflections and all the other things you're trying to keep on top of. I know it's a lot. It really is.
It is a lot, but it's shaping you and creating that professional part of your identity that is important in order to conduct ourselves and be ethical in this role. It's all very well and good to be a great helper, to be compassionate, empathic, and to be, interested and developing skills in doing intervention. But this is that whole professional side of it, and that's what's being shaped by us being required to do all of these things. Is we're developing ourselves into being a very organized, proactive, assertive, professional person. So by the time you do achieve all of this stuff, you'll come out the other side with that whole part of your professional personality or identity having been developed, and that will continue to develop as you go in your career.
It will, but when so it's nerve-wracking to record the sessions, but think about when you get the feedback and you can really reflect on what you've done well, but also I've got something to really work on here and continue to develop and to improve. And then you can use that for the next time. And it really does help, as Isabelle's saying, to really shape your practice. But it's such an opportunity because we don't get that later on. And I'm completing some training at the moment that does require a lot of practice and some observation, and it is daunting even now because when you're learning something new, I'm doing something new because it's something that I don't know and I want to learn more about, and so I'm having to be prepared to get things wrong and to accept feedback, but I know that's making me a much better clinician. And so if we can see that side of things and focus on what we're getting from it and the benefit, I think it's a lot more helpful because it can help us get past all of those initial nerves.
Most definitely. Were there any final thoughts that you had? Because I think we touched on most of the points that we wanted to share with our listeners.
Yes, I would just encourage people to really think about it and to go for it as early as possible. And I think the point that you made, Isabelle, about this being a minimum and really embracing the opportunity for learning and feedback, I think is actually such a lovely message, and one that that's what I would like to leave people with. Yeah,
that's lovely. That is really good. Yeah, it's definitely stuck out for me as I've been supervising students in the last year or two. Like, oh, hang on a second, you're going to get so much out of this. The more I see, the better off you're going to be. So it's a lovely thing to finish on.
Yeah.
Okay. Thanks, Claire.
Thank you. Thank you for tuning in today. If you enjoyed this episode, please take a moment to leave us a 5-star rating. It really helps others find the show. And don't forget to follow us on Instagram at Between Two Psychs for more updates and resources. For more information and to explore everything we offer, head over to our website, betweentwopsychs.com.au. We appreciate your support and we'll see you next time.